Hi everyone, it's Heather. I just wanted to do a video in the about the middle of my summer semester, so my third semester in the RT program, and just thought I would do a little bit of an update. I apologize for the poor video quality. I'm using my computer because I'm feeling lazy at the moment and don't want to set up my phone and all that. Um, so all of my classes, if you've watched any of my other videos about this summer, all of my classes have been online so far. We are going back to campus for lab 2 days a week. We were supposed to be doing so this week, but it got pushed back a week. So our first week actually going to campus and being there in person for lab is going to be this next week. I'm really excited about that. There's a lot of restrictions. When we have to enter through a certain door into the building. We have to check in and get basically a hall pass that says we're allowed to be there. We have to wear a mask at all times, no more than two people in any of the elevators. We have to wear a mask when we're in the classroom as well. And we have to be distanced, only one person at each table within our lab. And we can't get there early. We can't hang around after. No study rooms, no, anything like that. We can only use the bathroom that's on the same floor as our lab. Um, I have no problem with any of these restrictions. I'm not looking to get COVID. So if these restrictions will help keep me healthy, I'm all for it. The other exciting news is that we actually do get to go back into the hospitals. We could technically go, as soon as 2 days from now is when we're allowed to go back. I'm not going to be going back quite that early because I need to schedule time with preceptors. We're going to be doing precepting, not our regular clinicals. So the difference is clinicals are in groups. My group was only 3 people. Some people had 4. There may have been a group of 5, in fact. I'm not sure. Most groups were 4 people. And on clinical days, you were with someone who was getting paid by the school. So they were technically not like at their job that day. They were being employed by the school that particular day, but they would, so they could pick and choose, okay, we'll take, patients from this area and we'll do this. But they didn't have their normal work schedule when you were there for clinicals. Precept days are when you are going with someone who's there just doing their job and you're just going along with them. So whatever their assignment is for the day, you go with them and do whatever they need along their day. So it's a little bit different because clinical days tended to be a little bit slower. There was more time to have discussion, ask questions, look at equipment, that sort of thing. But honestly, I prefer precepting days. I just feel like I got more out of precepting, so I'm kind of glad that the rest of the summer is going to be precepting. So we have each been assigned to a specific person in a specific hospital. So we can't precept at different hospitals. We can only precept at the hospital that we're assigned to, and we have been assigned a specific person. I actually have 2 people because my main person works at 2 different hospitals. And so the hospital that I'm assigned to, she's not there very often. So I'm able to precept with her when she's at that hospital. But in order to give me more hours and more days, I also have a second person at that hospital that I can get hours with. So I'm really looking forward to that. My first day is actually going to be the 4th of July, is technically my first day back, unless I manage to schedule something with the other person before that. The other thing that I have to do before I can go back to the hospital is get fitted for an N95 mask. So each hospital has different rules, and I'm going to see if that helps with that weird light thing that's been flashing. I don't know if it's coming through on there, but I see it. So we have to get fitted for N95 masks. I've not done that before, but my understanding of the process is that you put a mask on and you have to be like in some enclosure sort of thing somehow. And then they spray in this like sweet saccharin kind of thing and you breathe in. And if you can taste it, then you know that you don't have a good enough seal on your mask. So then you have to try a different size. So we have to be fitted for those masks because when we are at the hospital, we have to wear an N95 mask and then we have to put a regular surgical hospital mask over top of that. but we cannot go back to precepting or anything until we have been fitted for the N95. So I have contacted the person who's doing the fitting, and hopefully we'll hear back from him so that I can get set up to actually go do that fitting. Um, and once I have my fitting done and have my time scheduled with my preceptors, to the hospital and start doing some work again, which I'm really looking forward to. As far as classes are concerned, classes haven't been super difficult. We've been doing mechanical ventilation. I'm really, really looking forward to getting into lab and actually getting my hands on a ventilator. It's a little bit different, I think, trying to use an online simulator, which we have access to, but I'll be frank, I haven't used very much. I just don't know, having not actually been able to change. I mean, I've changed settings under the direction of an RT in the hospital before. They've been like, push this button, press that button, do this, press accept. So, I mean, I've done that, but nothing on my own, obviously. And so without having done that on my own with a test lung and everything, I don't know how much the simulator is actually helping. So I haven't used it very much. But I feel like I've got a decent handle on mechanical ventilation at this point. Again, we'll see when I get into lab and actually have to do some of these things on the fly in that kind of situation. Last week in one class, we started in my cardiopulmonary physiology class, we started looking at hemodynamics, and that's kind of like difficult so far for me. I'm having a little bit of trouble wrapping my mind around some of the things. I think it's just a matter of I need to do some more reading in my Wilkins book and maybe in Egan's, and I think that's all it is. I just need to take a little bit more time to look at things. But I've had three tests so far, 2 lab checkoffs, which were basically just doing vent scenarios where we had several pages worth of things and we had to write down our initial settings, and then it would say, okay, you did an x-ray and this was found, or the doctor ordered this, and what do you do now? So having to write down what we would change the settings to and all of those things. And that's all gone fine. Haven't had any particular difficulty with the tests or the lab scenarios or anything. Have one more test, I think next week, I think. But when we go back to lab, we have to do the checkoffs that we missed from last semester because our semester got cut short in lab. I think we have to do extubation and suctioning. And I think there's a third one, but I don't remember what it is offhand. But we have to do those before we can move on to more scenarios and more lab checkoffs for this semester. So, kind of a lot of stuff to catch up on. We have to finish all of our hours, our hospital hours from last semester before we can technically start on our hours for this semester. So I think I have a total of like 175 hours that if I managed to finish them before this semester ended, I would be caught up. I don't know that I'm actually going to get that many hours in. It really just depends on how available my preceptor is. So we'll see. But I'm not super far behind as far as that's concerned. So I'm not real worried. Even if I have some carryover that I have to finish next semester, I'll manage that. Yeah, so that's the exciting stuff, is that going back to lab next week, and I will be starting back at the hospitals. And I did get into, I got assigned to a hospital that I really like, so I'm happy about that. Obviously, I would have been happy to go anywhere at this point, but I am happy to have gotten one of the hospitals that I've really enjoyed working at so far. So I will give you another update after I'm back, let you know how my first day back at the hospital goes, and some, to kind of take a look at what things are different, because I'm sure there's a lot of stuff that's being done differently now with PPE and what rooms we can go to, and if there's any restrictions, because before we were restricted, we couldn't go into any rooms that required N95 masks. So that may be different now, I'm not sure. Yeah, so I'll keep you updated on how everything's going. But if you're in school right now, I hope that you are moving along with your program. Let me know if you are back at the hospitals, if you're back on campus, how are your classes going? I would love to hear how anyone else is doing. All right, see you next time. Bye.